So let's talk about something that affects millions of women, uterine fibroids, and, the totally life-disrupting symptoms that can come with them. But what if there was a modern, minimally invasive way to find relief without resorting to major surgery? Well, that's exactly what we're going to dive into.
I mean, does this question hit a little too close to home? That feeling of constantly having to plan your life, your schedule, what you're going to wear, even vacations, all around your period? Yeah. If you're nodding along right now, you totally get it. You know exactly how much this can just take over everything.
And look, we're not talking about some minor inconvenience here. For so many women, symptomatic fibroids become this constant interruption. They just drain your energy and pretty much dictate every choice you make.
So what are we actually talking about when we say symptoms? Well, the heavy, prolonged bleeding, that's often the big one, right? It can lead to exhaustion, even anemia. That just messes with your whole day. And then you've got that constant pelvic pressure, the pain, and oh yeah, the endless trips to the bathroom. If any of this is sounding like your daily reality, trust me, you are so not alone.
And on top of all the physical stuff, there's this whole emotional side to it. It's that feeling so many women have where your concerns kind of get brushed aside, or you're told that a hysterectomy, this massive final option, is your only real choice. It can feel incredibly isolating, like you're just not being heard.
And for the longest time, the path forward has been, well, a really difficult choice. It's often felt like you're stuck between a rock and a hard place, with only a couple of not-so-great options on the table.
Okay, so on one side, you have hormonal treatments. And yeah, they can help manage the symptoms for a bit, but they don't actually get rid of the fibroids, They're basically a Band-Aid. Then on the other side, you've got major surgery like a hysterectomy. Sure, it's effective, but it's a huge deal. We're talking significant recovery time, and with a hysterectomy, it means the end of fertility. So you can see why women have been desperately looking for another way.
But what if that wasn't the end of the story? What if there was a door number 3, an option that just completely changes the conversation?
And that option is called Uterine Fibroid Embolization, or UFE for short. And honestly, it's a total game changer because it takes a completely different, way more elegant approach. We're not talking about cutting. We're not talking about removing organs. It's something else entirely.
So what is it? Well, instead of surgically ripping out the fibroids or the whole uterus, UFE works by shrinking them from the inside out. It's this super precise, image-guided procedure that basically cuts off their blood supply. And the most important part? The uterus is completely preserved. It stays right where it is. The easiest way to think about it is like this. If you stop watering a plant, what happens? It shrinks, right? It withers. UFE does the exact same thing to fibroids. You're not aggressively removing anything, you're just turning off their food source. By blocking their blood flow, the fibroids just naturally start to shrink and die off. It's a really smart, elegant process. Okay, so how does this actually work? You might be picturing something complicated, but you'd probably be surprised by just how straightforward and, well, minimally invasive it really is.
All right, here's how it goes down. It all starts with a tiny entry point. I mean, literally a pinhole, usually in your wrist or at the top of your leg. A super thin, flexible tube, that's the catheter, is then guided using live imaging. Think of it like a GPS for your arteries. It's navigated right to the blood vessels that are feeding the fibroids. Then, these microscopic particles are released, and they block the blood flow only to the fibroids. The healthy uterine tissue? Totally fine, it's spared. And then, the catheter comes out, and all you're left with is a tiny bandage. That's it.
So let's just recap the big wins here, because they are huge. First, it's minimally invasive. That means no major cutting, no stitches, you're not under general anesthesia, just light sedation so you're comfortable. It's an outpatient procedure, which means you get to go home the very same day. And the big one, your uterus is preserved. It's just a completely modern approach to a long-standing problem.
Okay, the procedure itself sounds incredible, right? But what about life after UFE? Who's actually a good candidate for this? And what can you really expect when it comes to recovery?
So who is this for? Well, it's a fantastic option for women who are dealing with those really disruptive symptoms, the ones that are just getting in the way of life. It's for women who've maybe tried medications and they just didn't cut it. And of course, it is a huge, huge deal for anyone who wants to avoid hysterectomy and keep their uterus.
And this comparison right here is where the difference becomes just night and day.
With a traditional hysterectomy, you're looking at a hospital stay, followed by a recovery period of 6 to 8 weeks. With UFE, you go home the same day, and most women are back to their normal routine in about 1 to 2 weeks. The difference in that recovery experience is it's massive. There's no other word for it.
Now, here's something that's really important to get, because this whole process works with your body, letting the fibroids shrink on their own. The relief isn't like flipping a switch. It's gradual. You'll probably start to feel a real difference in a few weeks, and then things just keep getting better and better as those fibroids continue to shrink over the next few months.
So just take a second and imagine it. What would it actually feel like to get that freedom back? To not have to plan your entire life around your period, to wear what you want, go where you want, and to just not have to think about it anymore. It's a powerful thought, right? That a procedure that starts with a tiny little pinhole could actually give you back that kind of daily freedom? Well, for so many women, the answer is a resounding yes.